Hi, I'm Sondra,
and we're the gals that keep you in the know. Sondra, we've got a few questions today, this time not from our agents, but this is going to be some good information for the seniors out there and people that are eligible for Medicare, wondering what this annual election period means to them.
Oh yes, annual election period, fall enrollment period, or fall open enrollment. We've heard it called many things. We're going to stick with annual enrollment period, and that's from October 15th until December 7th.
And our first question today, I thought I couldn't change my Medicare plan until October 15th, yet I'm already receiving calls. Is it okay or permissible to go ahead and meet with someone at this time?
Oh, that is awesome. This is a great time to meet with your field agent or someone over the phone. The reason is because there are a lot of plans out there, and they're starting to get the information of what's going to be available in 2014. So this is like your research time. It's time to learn what this plan is offering, what that plan is offering. Maybe to know also, you might want to get familiar with what plans your doctor's going to take. And this is your chance to find out what you need, what changed in your health, what is changing in your plan, and that way you can make a good decision for October 15th.
Mm-hmm. And if I do meet with an agent prior to the 15th, can my benefits go ahead and start early?
Oh no, you can't start your benefits until January 1st. That's when the benefits began. In fact, it's very important to remember that you should not be submitting an application, or your agent that you're meeting with cannot collect an application or enrollment form with a signature on it prior to October 15th. Do not sign anything. Do not submit anything. October 15th is that date. But bear in mind that the benefits still will not begin until January 1st.
Of 2014?
Yes, 2014.
Okay. And if at that time I decide that I'm unsatisfied with my plan, do I have the option of switching again?
Well, January 15th is known as the Medicare Advantage MADP, the Medicare Advantage disenrollment period. And this allows you to cancel your Medicare Advantage plan, but you cannot select a new Medicare Advantage plan. You have two choices. You can return to original Medicare and select a prescription drug plan. Now, when you return to original Medicare, that means that you're going to be responsible for the deductible for the Part A and the 20% coinsurance. You do have another choice, though. You can enroll into a Medigap plan. A Medigap plan does not follow the same enrollment guidelines that a Medicare Advantage does. They don't have an enrollment period or annual enrollment period, so you can choose a Medigap plan throughout the year. And when you do select that, you're going to want to keep that Part D. Now, if you were in your initial enrollment during the annual enrollment, so you're new to Medicare, you're turning 65, and you enrolled in that Medicare Advantage plan, then you have a special window for your Medigap plan. So be sure that you call us here at Trusted Senior Specialists and speak to one of our licensed agents, or we can have an agent visit with you in the home and explain that right that you have if you joined a Medicare Advantage during your initial.
Okay, great. When I choose to enroll into a new plan, will my doctor automatically be notified of the change?
No, and that causes a lot of confusion. Your doctor is not notified by the plan. They do have to get the name of your PCP because they need to make sure that your doctor participates in the network, you live in the service area, the doctor's is going to accept the benefits and the terms of that plan, but they're not notified. It's very important that you bring that ID card to the doctor's office and let them put that new information in there so that whenever you come to visit that they know exactly what your copay is, and then that you are in that plan and they know how to bill. So if you get any new enrollment cards or even your new prescription card, make sure you take that with you to the pharmacy. You got to have that information. And a lot of people don't know this. If you don't receive your card, because there's a lot of people enrolling, call your agent or call the plan, and they can give you your ID number and your prescription number over the phone, and you can give that to the pharmacist or your doctor until your cards actually come in.
So either way, it's my responsibility to notify my doctor that there's been some change and let them verify that new coverage.
Yes, it is absolutely your responsibility.
Okay.
Great question.
Good. And if I remain with my current plan instead of switching, but the benefits change, I've heard that from year to year, even in the same plan, they may change the benefits a little bit. How am I informed about that? How do I know to be able to make a decision if I want to stay or change?
Well, during this time of the year, you should be receiving right now or within the next month, you're going to receive what is called an ANOC, an Annual Notice of Change. And this is going to compare last year's benefits, which is the current year you're in, and what's going to begin on January 1st. So it's going to let you know, it's going to have a little comparison chart in there. It's great that you get this now because that's going to allow you that time to research the other plans and see if there's a need for change. And a lot of times you can find a plan that, if you're really satisfied and you're happy with what you have, but maybe the copay is going up or your drug may not be covered anymore, you may need to meet with one of us or have someone come visit you in the home, and we can find a plan that's going to give you the same benefits that you're looking for but enhanced, or make sure that drug is covered. So,
because those things are very important when selecting the plan.
And if your health changed, you may need to change your plan.
Okay. And is my doctor notified then, or is it still my responsibility to speak with him and let him know about those changes?
Oh, well, the changes, if your copay is changing, or if there may be where they might charge a little bit more for an outpatient service, or if the doctor's not going to be in contract, whenever you see them at the beginning of the year, when they call in to verify your participation with that plan, they are going to get the information from the plan that the copay has changed. But you would have received that early on, but the doctor's notified by the plan. So it's important they always have your current insurance information every time you go to the doctor.
Okay. And another question that we seem to be getting a lot is, I gave the agent permission to come out and meet with me when we spoke by phone. That's why they're here for the appointment. Why then do I still have to sign a piece of paper when they arrive, giving permission to speak with me about the plans I requested information on?
Well, that must be the scope of appointment you're talking about. And there seems to be a lot of questions about, why am I signing this? And like you said, I gave you my permission. You are an adult. You said, come see me. It's your health care. It's your business. The reason is because a lot of times it's really there to protect you. It's kind of like, if you can remember back in the day when you put your kid on the school bus and they went to the zoo and you signed that permission slip, I give my child permission. You give them permission to get on the bus every day to go to school. But now you're giving them permission to go to the zoo. So it's the same concept. I'm giving you permission to come talk to me about Medicare, but in order for me to talk about that Medicare Advantage plan with the added value benefits, understanding the network, understanding how a grievance and an appeal works, or how out-of-network benefits may or may not be part of this program, now I need to give you permission to talk to me in depth about that particular plan. A lot of times someone might say, well, I want to learn more about this plan because they saw an advertisement. Right now there's a lot of advertising and it sounds good. You call, you say, I want to learn more about XYZ plan. And the agent comes out, maybe your doctor's not in that network because maybe you didn't know how networks worked, or maybe you didn't like the co-payments. And you say, well, my doctor takes this plan because I saw the sign in the office. Well, now you have to sign a new piece of paper that says, I give you my permission to talk to me in depth about that plan. It's a way to protect you, because we have seen where, because you can make so many changes, sometimes the plan that you thought you were getting isn't the plan that you wanted, or it's just
not the best for you.
Yeah, it's really for your protection.
Okay, and we have one final question. Sondra, the Medicare and You handbook says something about star ratings. What are these star ratings, and is this something that I really need to know about? How does it affect me?
Yes, the star ratings are very important. What is happening is Medicare needs to measure how well plans are doing, because Medicare Advantage plans are private insurance companies that are contracted with Medicare to give you the same care that Medicare gives, but they have those added value benefits. And they have to give you all the preventative. So what happens is these star ratings they're measuring the relationship between the plan and the preventative and the proactive care of the doctor. It is much better to prevent than it is to treat. Mm-hmm. So when you get all those preventative exams that are required by Medicare, and the doctor is very proactive about getting this done, he reports back to that coordinated care plan, that insurance plan. Also, and I want to mention this, in the coordinated care plan, your specialist and your doctor are always communicating so that we see that there's a reduction of those drug interactions or adverse medications. We see less hospital readmissions or less stays, meaning you're not there for so long. They're not trying to get rid of you. They just see that you're healthier, you're getting over things quicker because you are proactive, the doctor's proactive, and the plan emphasizes that the doctor needs to be very proactive in your health care. It's sort of like a preventative path for you. When they do this and they're doing all these measures, they send this information up to the insurance plan, and the plan sends that up to CMS. And CMS looks across the board and says, well, they're meeting all their measures. And so they get these star ratings based on how well the plan and the doctor are being proactive. Mm-hmm. And that's very key. The goal is to get a 5-star rating. We see that most plans are in 3.5 to 4 stars. And that's kind of a new program that we're starting to see. So do pay attention to your star ratings. If a plan falls below the measure for more than a few years, I think it's 2 years, then they will lose their contract, or they will send a letter out to let you know that you have an option to change your plan if you feel you don't get in the care you need. So it is important that you keep up with those star ratings and know what your plan is doing for you.
Great. And you mentioned something about CMS. Everybody may not know what CMS is. Can you just kind of explain who they are and what they do?
CMS is Centers for Medicare and Medicaid Services. They are the oversight. That's what Medicare is. CMS is making sure that the rules are followed, the agents are doing their certifications, their AEP plans are doing what they're supposed to be doing. They are the really the eyes of Medicare for the beneficiaries, and their job is to really make sure that everybody's following the guidance and the rules and being compliant and ethical.
So while we may not understand all of the rules and the guidance that they have, it's really there to kind of oversee everything. They have the best interest of the beneficiaries who receive Medicare, in mind, and they're making sure that this kind of sounds like it would avoid a lot of duplicate testing that may not be necessary to help keep costs down. And if we keep costs down for the insurance carriers, then in turn the plans are more affordable for the people that are members in these plans. Is that right?
Absolutely. And I would say that it probably is going to keep Medicare funded for a longer period of time, because we do see a lot of duplicate tests, and fraud, waste, and abuse is one of the biggest oversights that they're responsible for, because we do see, and I'm glad you brought that up. A lot of people receive what they think is a bill. They go to the doctor or they go to the hospital and they receive a letter in the mail, and it's usually in a watermark. It says, "This is not a bill."
Mm-hmm.
And they'll say, "I just had heart surgery and my copay said it was only going to be $125 for a day. I was there for 5 days and I got a bill for $37,000.
Right.
That's not your bill. What they have to do, though, is the plans have to send a copy to you of what was billed for, and they're asking for you to look to see if there was something that just didn't. There wasn't a procedure done that the insurance is being billed for, or maybe there's a medication that you were billed for that, or the plan was billed for
that you didn't receive."
Exactly, and they're looking for fraud because it is out there. And so they're asking that as a beneficiary, you are looking over those statements and verifying that those are accurate. And that $37,000 is not your responsibility, you're going to pay what the plan says you have to pay, but it's showing you what was billed and then what was paid by the plan, and then what is going to be. It usually takes about 60 to 90 days for those to finish reconciling.
Perfect.
And if you ever have a question, call your plan and they will help you know what you're responsible for.
Okay. And I think that's everything that we have for today. I think that's a lot of useful information.
Oh, great. Yeah, we had a lot of good questions. We want to keep them coming in. Ask us questions, email us, call us. You can email the Medicare Gals at trustedseniorspecialist.com. So we like these questions. Well, blessings from Trusted Senior Specialist, and of course, blessings from
The Medicare Gals.